I saw a post today by a daughter. She was writing, "Sorry mom, we couldn't get you back home. You trusted us. Even though families tried their best, health facilities were just not available." National disaster management was all storytelling. The reality on the ground was different. I remember there was a time when every call I was getting was for an oxygen cylinder. People were dying because there was no oxygen. One thing that has clearly come out through the pandemic is that it was not COVID-19 that crashed India's healthcare, but it was COVID-19 that exposed the broken healthcare system. India was built on the ideas of any good socialist nation that has healthcare for all. It should not be a luxury, but an essential service accessible to all, just like food and shelter. But over the last many decades, if you walked into any public health facility, you would see that doctors are just not available. If they are there, then there are large lines. They treat patients with utter disrespect, and facilities are mostly broken. Medication is non-existent. Patients are running helter-skelter to get their own medicines and injections. In short, it is a broken system, hanging on the goodness of few medical professionals who were trying their best to deliver in an economy where all else were working for profits. Many government doctors run their private clinics and continue to make large amount of money, and the system continues to drown. The pandemic saw the worst, where people were dying due to oxygen shortages, unavailability of hospital beds, ventilators, and also expensive drugs which were unaffordable for the majority. Pandemic has exposed the healthcare setup in India and its weaknesses. Instead of declaring victory over COVID after the first wave, it was the time for governments to get along with medical associations and try rebuilding them. Isolating the virus was much easier after the first wave, but India became lackadaisical. There were wedding parties being organized, there were numerous gatherings, social, political, and religious, which turned out to be super spreaders. With this as a backdrop, the third wave almost seems inevitable. This is the time to act. There are multiple ways to do so. Humans play most important role in breaking the chain of the virus. By maintaining social distancing, wearing masks, keeping yourself and your vicinity sanitized, and by getting vaccinated, we can isolate and eliminate the virus. It isn't some cat and mouse strategy. For breaking the chain, we need to act until we witness 0 new cases and all the population is fully vaccinated.